Good evening. 19th of May 2023. It's now 6 weeks since I've had my prostatectomy at the Norfolk and Norwich Hospital here in the UK in the East. Just like to say thank you for everybody who watches these little vlogs. Really happy I've done them. Made me feel very good. A lot of good messages left on the comments section after the videos. Or a lot of people who message me privately on Messenger and WhatsApp just to say thanks. Say I really looked forward to doing them. Before I start, the information I give out this afternoon or this evening is I'm not a doctor. Believe me, I'm not a doctor, and I've just sort of tried to learn a little bit about the condition. And so what I'm going to say is it's probably not medically correct, but I'll give my version of what I think is. So today I had my PSA 6-week blood test. There is no prostate no more, so hopefully the result will come back as a 0.01 undetected. That's the hope. If it comes back anything different, 0.3, 0.4, 0.5, 0.6, something like that, it obviously means that some cancer has been left in the body and it's escaped the prostate, and we're going to have to go down a different road to that. But we'll cross that bridge when we come to it. Hopefully we won't have to go down the radiation route. I believe we have to have a PSMA scan, which then locates where all the cancer cells are left. But then it'd be the radiation sort of beam, which you can have 20-30 sessions of them. So next Tuesday is I have a call from the surgeon to discuss today's blood test and hopefully give me the good news. And also it goes over the pathology of the prostate. It's probably the biggest phone call I've ever had in my life, and let's just hope it's good news. The prostate gets sent away for people, pathologists, to. I watched on YouTube. They colour half of it in like a blue ink, or half of it in a black ink, and then they start dissecting bit by bit by bit, and that's where they make their report from, going into different margins. Have they done this? How far has it spread? And they give it all different types of scores. So just going back to the biopsies and just trying to understand the biopsy reading. When you have your biopsies, you get diagnosed with the cancer. They give you what they call a Gleason score. A Gleason score is made up of two numbers. The lowest Gleason score you can get is a 3+3, and which is a very slow growing cancer, and it's probably the ones they say you'll die with it rather than of it. It's a very slow growing, and they're not too bothered too much about it. And what they'd normally do is put you on an active surveillance. Just keep an eye on your blood tests every 3 months, 6 months, and then treat it if it starts going up. That's stage 1. Stage 2 is what they call a 3+4. 3+4 is they'll have a look under a microscope, your biopsy, and they'll have a look at different structures, the way the cancer is formed. If they see a lot of the 3 cells and some of the 4, whatever number's first is the biggest. So 3+4 is, they'll probably say, if I 75% 3s and 25% 4s. A 4 is a more aggressive growing cancer, and that's a 3+4 equals 7. Flip it around, a 4+3 is a 7. They're found under the microscope more 4s than 3s. So again, that's more of an aggressive cancer. It's on the march, it's growing quicker. So it could be 60-40, it could be 70-30, it could be 80-20. But there's more of the first number, which is a 4, than the second number, which is a 3. And that's stage 3. Stage 4 is a 4+4. which is all the biopsy is aggressive growing, and a 5+5, which isn't so good. If you've seen some of my earlier videos, I've said that I had 5 tumours. 4 of them were 3+4s, and 1 was a 4+3. So that's why the surgeon said we needed to have treatment, because it was on the march, and if left any longer, it could have caused problems down the road. So that's how that works. So the good thing is I have my pathology report. I asked for a copy, and they've downgraded me, or they've downgraded that one from a 4.3 down to a 3.4. So again, there's more 3s than there are 4, so that's positive. Once they've dissected the prostate, they give you what they call a TNM score: tumour, nodes, metastases. The way that works is a T score. A T1 is basically, it's not been found by doctors, it's not been found by you having any symptoms, it's just found randomly. If you go for an operation or something and you have a blood test, it's just found unintentionally. So a T1, they're not too bothered. The T2s are a little bit more aggressive. A T2A, which means there's a little growth just on one side. A T2B just means a bigger growth on one side of the prostate. And a T2C is there's tumours both sides of the prostate. My naughty one was a T2C. T1 and T2 basically means contained within the prostate. So that's the big number you need to know. Is a T1 or a T2? If it's either of them, then they're pretty confident it's within. T3 and T4 gets a little bit more complicated. It's broken out the prostate. It's on the march to the semivesiculars and the lymph nodes and all that. So you don't really want to see a T3 or T4. So again, a T2A, small tumour on one side. A T2B, a bigger tumour. And a T2C is just tumours either side of the prostate. So I've had a look at the report, and from what I can decipher, you just break it down little bit by little bit by little bit. Doesn't look too bad, actually. Again, I won't know until Tuesday. He's going to give me the report, and again, I'm not putting my hopes up high. I just like to know what I'm looking at before and ask questions. Basically, I want to try and decipher what's this margin and that margin. So he's gonna tell me on Tuesday. So in myself, I feel 80-85%. The incontinence, it's I go to the toilet every 3 hours. That's just it was normal before my surgery. And again, as I said in previous videos, men can normally hold 400 to 500 mil. I never did. I'm probably a 200 mil tops, and it's the same now. What I have noticed in the last few weeks, again, this is maybe a tip that anybody wants to know, is drinking water, drinking squash. Do not drink carbonated drinks, any fizzies. I like a tin of Pepsi Max here and there, Tango, but when I have them, it seems like I want to go more often and not much come out. So I reverted back to the squash at work today, and I've been holding it for 2 to 3 hours, if not a little bit more, and then that goes back to sort of your 200 mils. And when you read about it, they say to keep off carbonated drinks. Again, I don't drink tea or coffee, so I can't comment at all on that. But I'm gonna leave the fizzies alone and just concentrate on just water or a fruit flavoured squash or something like that. So again, I'm feeling good. The wounds are healing, apart from one, which is what they call the JP, the Jackson Pratt drain. There's a little little scar there, a little scab there, which is trying to heal, but it's still not going. The other 5 are completely gone, healed up, and you can hardly notice them. So yeah, little bit by little bit, we're getting there. Again, we know Rome wasn't built in a day, so I'm not expecting too much too quick. So Tuesday, 3 o'clock, 2:20 or something, surgeon's report, and hopefully it will be good, and maybe I might treat myself to a little drink afterwards, and we'll go from there. So thanks everyone for watching, and we'll be back on Tuesday to give you the report of the surgeon's pathology and the PSA test, which I'm hoping comes back 0.01 undetected. So thanks everyone for watching, and I'll see you next time. Thank you.